Hi everybody, today we will discuss the radiotherapy principles. Our objectives are how does radiotherapy works, biology of radiotherapy, goals of radiotherapy, types of radiation, radiotherapy machines, technique of external beam radiotherapy, and brachytherapy. Cancer remains leading cause of death globally. Cancer is a multigenic and multicellular disease that can arise from all cell types and organs with a multifactorial etiology. After the discovery of X-ray, its clinical uses as a means of cancer treatment was appreciated. Principles of radiation therapy. Radiation is a physical agent which is used to destroy cancer cells. The radiation used is called ionizing radiation because it forms ions and deposits energy in the cell of the tissue it passes through. This deposited energy can kill cancer cells or cause genetic changes resulting in cancer cell death. How does radiation works to treat cancer? To know how radiation can kill cancer, you should understand first the normal life cycle of the cell. This is the normal life cycle of the cell, in which G0 cell rests from division, G1 RNA and proteins are made for division, S synthesis, DNA is made for new cells, G2 apparatus for mitosis is built, M mitosis. The cell cycle phase is important in cancer treatment because usually radiation first kills the cells that are actively dividing or highly dividing cells. It doesn't work very quickly on cells that are in the resting stage. Cancer cells tend to divide quickly, as you know, and grow out of control. So radiation therapy kills cancer cells that are highly dividing cells, but it also affects dividing cell of normal tissues. The damage to normal cells causes unwanted side effects. So the effect of the radiation therapy on cancer cell called therapeutic effect, and on the normal tissue it is called side effect. Radiation therapy is always a balance between destroying the cancer cell and minimizing damage to normal cells. Biology of radiation therapy. The biological target of radiation in the cell is DNA. Extensive damage to cancer cell DNA can lead to cell death. The radiotherapy causes damage to DNA through single-strand break or double-strand break. DNA double-strand break are more responsible for most cell killing. Even a single-strand break is sufficient to kill a cell or disturb its genomic integrity by the radiation treatment. This double-strand break of DNA and single-strand break of DNA. So, the radiation can kill cancer cell through direct action, through DNA damage and then cell death, or indirect action through production of free radicals, which causes DNA damage and then cell death. Exposure of cancer cells to radiation therapy causes genomic instability and hence cell death. Goals of radiation therapy: to maximize the radiation dose to abnormal cancer cells while minimizing exposure to normal cells, which is adjacent to cancer cells or in the path of radiation. Normal cells usually can repair themselves at a faster rate and retain its normal function status than the cancer cell. Cancer cells in general are not as efficient as normal cells in repairing the damage caused by radiation treatment. So goals of radiation therapy: to cure or shrink cancer, to stop cancer from recurring again, to treat symptoms caused by advanced cancer. So even in advanced cancer, you can use the radiotherapy to palliate symptoms, to treat symptoms caused by advanced cancer, which is called palliative radiotherapy. Indication of radiation therapy include Combination strategies with other treatment modalities such as surgery, chemotherapy, or immunotherapy. If the radiotherapy used before surgery, it is called neoadjuvant therapy, in which the radiation aims to shrink the tumor or downstage the tumor. If it is used after surgery, it is called the adjuvant therapy, in which the radiotherapy destroys a microscopic tumor cell that may have been left behind, so prevent the tumor from recurring again. It is well known that tumors differs in their sensitivity to the radiation treatment. Types of ionizing radiation. Ionizing radiation may be photons as gamma rays or particle radiation such as electron, proton, neutron, carbon ions, alpha particles, and beta particles. How the radiotherapy beam can be delivered? It can be delivered through a machine, which is called external beam radiotherapy, or can be delivered through radioactive source implanted in the tumor itself, which is called internal beam radiation or brachytherapy. External beam radiotherapy is a radiation delivered from outside the body by high energy rays, photons, protons, or particle radiation to the location of the tumor. This is the most common approach in the clinical setting. Internal radiation or brachytherapy is delivered by radioactive sources sealed in catheters or seeds directly into the tumor site. This is used particularly in the treatment of gynecological tumor and prostatic cancer. Radiotherapy machines which delivered the radiotherapy beams may be X-ray machines, cobalt-60 machine which depends on natural radioactive source, and linear accelerator machines which produces gamma rays and also produces electron beam, while cobalt-60 produce only gamma rays. This is a diagram for linear accelerator in which there is an electron gun which produces an electron and accelerator tube in which the electron accelerated, and magnetron or klystron which produces electromagnetic wave which carries the electron, and treatment head from which X-ray emitted, gamma rays, or electron beam emitted. This is a photo for cobalt-60 machine which depends on natural radioactive source, cobalt-60, placed in a large head of lead and produces gamma rays only. This is a multi-leaf collimator which is located at the head of the machine, of the radiotherapy machine. The function of multi-leaf collimator is to simulate the tumor as seen in the CT. It makes the radiotherapy beam to take the same shape of the tumor, so it prevents the radiation to pass through the adjacent normal tissue. Radiation therapy techniques. Fractionation. What is the meaning of fractionation? Fractionation means the radiotherapy delivered in doses, in fractionated doses, not in a single dose. It is based on the differing radiobiological properties of cancer and normal tissues. This is fractionated doses amplifies the survival advantage of normal tissue over cancer cell, largely based on better supply cell damage repair of radiation damage in normal cells as compared to cancer cell. So, using fractionated doses help the normal tissue to be recovered from the supply cell damage effect of radiotherapy. Technological advances. When you treat a patient with cancer by using radiation therapy, you need patient with cancer, you need machine to deliver the radiation beam or radioactive source to deliver the radiation beam, and you need a technique to can deal with this beam. We have many techniques for dealing with radiotherapy. This technique may be 2D radiotherapy, 3D conformal radiotherapy, stereotactic radiotherapy, intensity modulated radiotherapy, or IMRT. 2D radiotherapy, in past we used the radiation therapy by using 2D technique, but nowadays 2D technique used only in palliative conditions. 2D radiation therapy using rectangular fields based on plain X-ray imaging has largely been replaced by 3D radiation therapy based on CT imaging, which allows accurate localization of the tumor and the critical normal organ structures for optimal beam placement and shielding. The aim is to deliver radiation to gross tumor volume, GTV. This GTV, it is a tumor volume which can be seen in CT or MRI, with a margin for microscopic tumor extension called the clinical target volume, CTV. CTV, it is a GTV plus 2 centimeters to cover the microscopic extension of the tumor. And further margin uncertainties from organ motion and the setup variation called planning target volume, BTV. BTV, it is a CTV plus 1 centimeters for setup uncertainties. So when we treat the tumor, finally, we treat the tumor with BTV. Intensity modulated radiation therapy, or IMRT. IMRT allows the oncologist to create irregular shaped radiation doses that is conformed to the tumor while avoiding critical organs. Computer controlled intensity modulation of multiple radiation beams during treatment can be delivered by linear accelerator. This has allowed improvement in therapeutic ratio for several tumor sites, such as head and neck tumor, prostate cancer, and gynecological cancer. In other words, intensity modulated radiotherapy is similar in technique to 3D radiotherapy. It depends on CT localization also, but it deals with the tumor as a segment. It divides the tumor into segments and it deals with each segment. And finally, make a homogeneity in the doses between this segment. So through this technique, we can deliver the high doses or uses high doses of radiotherapy to the tumor, and at the same time decrease the radiation doses to the adjacent normal structure to the minimum. In other words, in Arabic for translation, الانتنستي modulated radiotherapy ده هو زيه تقريبا في التكنيك زي ال 3D، يعني بيعتمد في اللوكاليزيشن او في التارجتنج بتاع التيومر على السي تي بيكتشرز او السي تي فيلمز، لكن هو بيختلف في الديلينج مع التيومر. هو بيقسم التيومر لاجزاء وبيبدا يتعامل مع كل جزء على حده ويديله راديشن دوزس، وفي الاخر يعمل هوموجينيتي بين الدوزس الكتيره دي، مش زي ال 3D. ال 3D بيتعامل مع التيومر كوحده واحده، كتيومر واحد. فطبعا من خلال التكنيك بتاع الاي ام ار تي ممكن نزود الدوزس للماكسيموم، في نفس الوقت الادجيسنت نورمال تيشو ما بتاخدش دوزس كتيره، بيبقى الدوزس بتاعتها مينيمم، فما بيحصلش السايد افكتس المتعارف عليها من الراديوثيرابي، السايد افكتس بتقل. Stereotactic body radiation therapy. This is another technique for the radiotherapy, which precise delivers very high individual doses of radiation over only a few treatment fractions to ablate small, well-defined primary and oligometastatic tumors anywhere in the body. This has shown excellent result in the treatment of early-stage non-small cell lung cancer in patients unfit for surgery. Other tumors include prostate tumors or prostatic cancer, head and neck cancer, hepatic renal cancer, oligometastasis, spinal and pancreatic tumors. In other words, in Arabic for translation, الستيريوتاكتيك بودي راديشن ثيرابي ده بيعتمد على ان احنا بندي هاي دوزز اوف راديوثيرابي سنجل شوت اور تو شوت ماكسيمم 3 فراكشن، مش زي اللي هو الاوردينري او النورمال راديوثيرابي اللي بنديه فراكشنز كتيره، زي مثلا في البريست بندي 25 فراكشنز واحيانا 14 فراكشنز، لكن الستيريوتاكتيك بيعتمد ان انا بدي هاي دوزز اوف راديوثيرابي في سمول فراكشنز ممكن 1 fraction أو 2 fraction، وده بيبقى suitable لتيومر معينة زي اللي هو small sized tumor، زي في البيتيوتري tumor، زي في السمول brain tumor. So stereotactic body radiation therapy increase the therapeutic efficacy because we can give through it we can give high doses of radiotherapy in single shot or 2 shots. Positioning aid. What is the meaning of positioning aid? When you treat a cancer patient with radiation, you need patient with cancer, you need source to deliver radiation, either external beam or internal beam radiotherapy, and you need technique to deal with the radiation beam, and you need positioning aid. Why you need positioning aid? You should fix your patient well during the setting of radiation therapy, because if the patient move 1 centimeters, this means that part of the tumor becomes away from radiation field and part of the normal tissue enter in the radiation field. So we use the positioning aid for fixation of the patient, to immobilize the patient during the radiation setting. As you see here, pituitary port for pituitary tumor, 3-way support. It is a mask face, thermoplastic mask face, to fix the patient during the setting of radiotherapy in head and neck tumor and brain tumor. Prone support used in posterior fossa tumor. Another type of positioning aids like thermoplastic sheets, alpha cordal mini pales foam for leg support or leg fixation, vacuum mattress. This is vacuum mattress take the same impression of the body of children, so during the setting obligates the child to lie in the same manner in each setting. Brachytherapy. Brachytherapy can be used to deliver the high doses of radiation to a small area in a fairly short period of time. It's useful for tumors that need a high doses of radiation or are near normal tissues that are easily hurt by radiation. The main types of internal radiation are interstitial radiation or intracavitary radiation. Interstitial radiation, the radiation source is placed directly into the tumor or next to the tumor using small pellets, seeds, wires, tubes, or containers. Intracavitary radiation, a container of radioactive material is placed in a cavity of the body such as rectum, uterus, or vagina. So, radiation therapy is a physical beam which deposits energy in the cell, causing destruction of the cell, especially the highly dividing cell. And as you know, tumor or cancer highly dividing cell, so the radiation affects more on the highly dividing cancer cell. It hits the DNA of the cell, causing destruction and genomic instability of the cell, and then cell death. When you treat the patients with radiation therapy, you need patient with cancer, you need also source for radiation, and you need technique to deal with this radiation. The aim of using radiotherapy is to prevent the cancer from the recurrence, to shrink or down staging of cancer, or to palliate the symptom of cancer. So that is all. Have a nice day and thank you.